Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Chandrakala V. She has done her BDS from Vakkaliga Sangha Dental College and then done her MDS in surgery from Bapuji Dental College, Davangere. Now, presently, she is working as a professor of prosthodontics at KLE Dental College, Bengaluru, and she is the winner of Best Scientific Paper, Best Innovative Poster Presentation, and also she has won the most prestigious Walkaway of Discovery Award at the Asian Largest Biotech Summit in 2024. And now she is the convener of Women's Dental Council, because there are many women who have become dentists, and then the women, they have formed their own association. Welcome, Dr. Chandrakala. It's a pleasure
Warm
to have
greetings,
you.
ma'am. Thank you so much for the introduction, ma'am. Thank you so much.
Okay. When the baby is born, though the teeth are not there, we find when the baby smiles, we find it so beautiful. But then when the two bunny teeth come, we start, everybody's excited, the bunny teeth have come. And then, when the child starts going to the school and the front teeth fall off, oh, the gate is open now. You are not going to get back. You have become old. We start it's that needling the child. And then, once they grow up and they're young, they think that the teeth are there, they are so strong and nothing can happen. But only as the age advances, they start losing the teeth and they realize. And then at the old age, when they become butchbai, without any teeth, they start feeling very bad and shy, and their nutrition also goes down, their health goes down. So you please tell us about what are the types of teeth and what is the importance of maintaining the hygiene of the teeth.
Yes. Yes, ma'am. Whatever you said, absolutely it is true actually. So whenever the kids are there, maybe without the teeth also, they look so beautiful. Actually, in a human being face, two faces
Yes.
we can see. One is
Yes.
that younger ones when they don't have teeth, and also the elder ones when they don't have teeth. They will just look like again the small kids only. We appreciate that
Correct.
actually smile without teeth also. Coming back to the types of teeth, ma'am, we have something called as temporary teeth or deciduous teeth, and then the permanent teeth. Usually, this permanent, as much before permanent teeth, these deciduous teeth actually erupts or comes in the oral cavity or mouth within 6 months to 2.5 3 years old. So these teeth, these primary teeth are temporary teeth, are deciduous teeth we often call. So it will exporiate. It falls on its own naturally. Then the natural permanent dentition comes. That is between the age group of 6 years to 12 years. So then after 12 years also between 17 years to some 25 years, we do get something called as wisdom tooth. So that is the
Okay.
third molar. That is the actually like most of the function it is served is nil by that tooth actually. But otherwise, whenever it is intact and it is well positioned in the jawbone, so it is much maintained well, so that it will also help in the bone health actually.
But you know what happened when I was doing my MD? I was a postgraduate, and that time I had a very severe pain. It was so severe, unbearable. And then when I went to the government dental college, and then they said it is impacted, and they went on chiseling and they tried to get it, and it remained impacted. And even
Yes.
now, I don't have the wisdom at all because the wisdom tooth is impacted there only.
That's actually
It,
you're lucky, ma'am. Except for that tooth which caused you some pain during your MD period. Otherwise, you are lucky only because whenever it is there and it is going to create some problem because the jaw size is very small and there is no space and all, it creates more of problems. So it is better to remove it, get it removed, and then be like aram say like normally only like it is better. So then
No,
coming
they
to
could not remove. They could not remove it.
yeah,
Remained there only. I'm
yeah.
there with the
Until and
impacted
unless it
tooth.
is not creating any problem, we can just leave it in the bone only, ma'am. Let it be submerged like that. So depending on the clinical cases, we will decide when to remove it or when to leave it just like that. So then apart from that, all other teeth are like helpful in like the beautiful smile, and then the bringing the confidence of the patient, then also for the chewing, biting purpose, all that. So even for the speech also. So whenever we speak actually, so our phonetics will be, we can pronounce the things
I know.
better
Yes,
when we
yes,
have teeth.
yes,
That is very,
yes.
very important, especially in
Very good.
professions like priest, lecturers, all good orators, they need teeth for the better
Yes,
articulation.
yes, yes. I agree.
Yes, ma'am. So after these deciduous teeth are primary teeth, exfoliates are like it falls on its own. Then the permanent dentition comes into the mouth. So they are very, very important to take care. Even the
And what are
deciduous
the causes of falling of the teeth, the permanent teeth? Because the
uh,
people should know that how to prevent the falling of the teeth, no?
yes, ma'am. Not only during the permanent, not only the permanent teeth, ma'am. Actually, even the primary teeth also. Sometimes the kids will tend to fall. They will fight, actually hit them each other. So like that. So that time also, that actually the teeth damage will happen. That time also we have to consult the nearest dentist, and then we have to get it repaired or replaced, whatever. So that will help in maintenance of the permanent teeth dentition. So whatever
Okay.
we take care usually during those first initial 6 years, that will be well maintained by the like permanent teeth throughout the life till 60 or 70 years of age.
Okay, 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 okay.
So then coming to the
Now,
permanent
yeah,
teeth, yes, ma'am.
permanent teeth. You please tell about that. Okay.
Yes, ma'am. Permanent teeth, there are actually many reasons are there. First thing being, no, I think all of you would have noticed, if you don't brush for 1 or 2 days, a thin layer of plaque, white color layer will be formed on the teeth. That is called as
Sometimes the
dental
yellow
plaque.
will be there, no? Yellow
Yeah.
this thing. Yeah.
Whitish yellow, or so yellowish white or whatever. Like that plaque is the like actually we can say the big culprit for everything, the problems. So because of that, that becomes harder and it turns into something called as calculus. So that will eventually make the surrounding bone to become weak, and it will start shaking and it will fall on its own. That we call it as gingivitis or periodontitis in our medical terms. So whereas in case of like if we eat often, we childrens and even we elders, we often eat so much of sweet, sugar, chocolates, everything. Not only that, even the junk foods, daily what and all we
I
consume
know.
junk food,
Yes,
or
yes.
any even the fried items also, like it will add on to the plaque formation that will lead to eventually the dental caries, that is the tooth decay, as well as the this periodontitis, ma'am. So it
Okay.
is very, very important to brush our teeth twice daily. If not twice daily possible, at least once in a time, but thoroughly and properly by knowing the brushing techniques. So we have to
Okay.
maintain our oral hygiene.
Yeah, only brushing is enough or anything else is
No, ma'am.
required,
Again, see,
like a gargling or removing the
yes,
food particles in between? Because no, despite of blushing, many times, brushing is not adequate.
yes,
What
ma'am.
do you suggest?
So then the first and foremost step is brushing twice a day, ma'am. That is the most important protocol. Then along with that, depending on like suppose if as we grow old and all, so that the gaps between the teeth will be formed. So that has to be clean. Or even when the teeth are very well intact also, we can use something called as dental floss. Dental floss is a
Okay.
small thread actually, like which we can pass it between the teeth, and then we can get it clean. Suppose sometimes if we can see observe, sometimes if we eat something, it will get stuck in our teeth. So in between the teeth, that we can remove. With the normal brushing, it will not go.
But
So that way we
many
can use
people
dental
know they
floss.
use the toothpick and they
No,
keep
no,
something in the olden
no, no,
days.
no.
That is not good.
That I
No?
don't suggest, ma'am.
Yes.
Actually, they think that they're removing the food particle. In the way, actually, they're creating a way for the more food particles to
Go
accumulate.
there.
Actually,
Yes,
that
yes,
is
yes.
not suggested. So, if they want to remove any food particles stuck between the teeth, it is always better to use the dental floss. And as you told, ma'am, actually, when the warm water with a pinch of salt, that warm water gargling is also very,
Just
very beneficial.
gargling. What about the
Yeah.
coconut oil? Some people suggest that with the coconut oil they have to gargle and thing.
That actually, as a dentist, we don't have any
You
literature
don't.
support, ma'am. Actually, so we
Okay,
don't suggest
okay,
with the lukewarm
okay.
water with a pinch of salt. So that much that will be doing, and anything we eat, yeah, that anything even normal after consuming a beverage also, small liquid or beverage also, it is always a good habit to rinse our mouth with normal water.
Okay, okay. So brushing teeth twice daily, and after every morsel of food or drinking or anything, you have
Yes,
to
ma'am.
gargle and clean the teeth and see that nothing remains there. And that's
Yes,
how.
that is
And
that is very,
yeah,
very much required for a person
okay,
to maintain the oral hygiene. Then
okay.
coming to the reasons of fall of the teeth, like when they can lose the teeth means. So I told you, as I told before, tooth decay, that is the dental caries, and then the gingivitis, gum problems related to that, periodontal problems. Then it can be like accident, road traffic accidents, or even sometimes even the congenital missing of the teeth. All that they are like possible that will
And
lead to
also this chewing
eventually.
the tobacco, that also
Yes,
harms, no?
actually, that will indirectly, like it will affect the teeth, but it affects the so much of
Like
something called as
gutka and
uh,
all those pan masala, they have the
yes, ma'am.
chemicals and which can erode the
Yes,
teeth.
it is
And
very,
I've
very
seen people
harmful for
having
the.
very tiny teeth, you know.
Yes,
Yeah.
ma'am. Than the teeth, if it affects the soft tissues, ma'am. Like suppose
Mm.
the mucosa, that is the cheek soft tissue part, and then on the tongue. So we can see some lesions if they consume it for many years. So that will become a habit for them. So that will
Mm.
eventually lead to many precancerous lesions and conditions. And some, if their luck is bad, it will turn up into cancer also, oral cancer
Oh,
also. So it is always
okay.
better to avoid tobacco product in any form, actually. And also
Okay.
smoking, not only on the teeth, even in the on the general health, like as we know, or as we are aware, like low birth weight babies, and also like indirectly yesterday only, like we heard your talk, ma'am, that is about cardiac health, it affects. So many other medical issues also it will lead to. So it is always better to avoid tobacco in any form.
Yeah, yeah. So thank you very much. You told that
Thank you.
even the milk teeth or the deciduous teeth, they are also important and they should not damage. Otherwise, you know, the future teeth will also, the health will be damaged. And
Yes, ma'am.
brushing twice and keeping the mouth clean is very important, you said. And since you are an expert in making the artificial denture, we will listen to you in the next episode
Yes,
how
ma'am.
exactly you treat the people when they lose their teeth, and let us learn from you more.
Yes,
Thank you
ma'am.
very
Sure,
much,
ma'am.
Chandrakala, for
Thank you, ma'am.
giving such good tips to our viewers. Thank you.
Thank you so much, ma'am.